Chapter 40, Hygiene. Personal hygiene influences patients' comfort, their safety, and well-being. Hygiene can include cleaning and grooming activities that maintain personal body cleanliness as well as appearance. Healthy people are routinely able to meet their own hygiene needs. However, physical or cognitive impairments as well as emotional challenges often cause individuals to need some degree of assistance with hygiene care. The skin has several functions. It includes protection, secretion, excretion, body temperature regulation, and cutaneous sensation. The hands, feet, and nails often will require special attention to prevent infection, odor, and injury. The condition of the patient's hands and feet influences their ability to perform their own hygiene care. Without the ability to bear weight, ambulate, or manipulate their hands, a patient is at risk for losing their self-care ability. The oral cavity consists of the lips surrounding the opening of the mouth, the cheeks running along the side walls of the cavity, the tongue and its muscles, and the hard and soft palates. It also includes the mucous membranes, and it's continuous with the skin that lines the oral cavity. Hair growth, distribution, and pattern indicate a person's general health status. Special hair care practices focus on care of the scalp, axilla, and pubic areas. Hormonal changes, nutrition, emotional and physical stress, aging, infection, and some illnesses will affect hair characteristics. The eyes secrete tears, which contain substances to cleanse and lubricate the eye and protect it from bacteria. Specialized glands in the auditory canal secrete cerumen, which traps foreign bodies and repels insects. Cerumen can build up and become impacted in some people. Patients with alterations in one or more of their senses often will need help to meet their personal hygiene needs. While reading this case study, consider the types of assistance with hygiene that Mrs. Winkler might need. Consider the hygiene risks that exist for Mrs. Winkler. What would be some ways that Jamie could help Mrs. Winkler maintain her own independence? Social groups influence our hygiene preferences and practices, including the type of hygiene products that we use, the nature and frequency of personal care practices. Parents and caregivers perform hygiene care for infants and young children. Family customs play a major role during childhood in determining the hygiene practices, for example, such as the frequency of bathing. Patients have individual preferences about how and when to perform their own hygiene and grooming care. Patients will select different hygiene and grooming products based on their own care. A body image is the person's subjective concept of their body that includes the physical appearance, the structure, or the functioning. Body image does affect the way in which individuals maintain their personal hygiene. A person's economic resources will also influence the type and the extent of the hygiene practices used. As nurses, we need to be sensitive when we consider a patient's economic status because it influences the ability to maintain regular hygiene. The individual may not be able to afford their desired basic supplies, for example, deodorant, shampoo, or toothpaste. Knowledge about the importance of hygiene and its implications for well-being will influence the hygiene practices. Although education and knowledge alone is not enough, the motivation also plays a key role in the patient's hygiene practices. A cultural belief, religious practice, and personal value will influence hygiene care. People from diverse cultural backgrounds, thinking of level of education, geographic location, they frequently follow different self-care practices. When thinking of the developmental stage, we need to think about the neonate's skin and its relative immaturity at birth. Both the epidermis and the dermis are bound together loosely and their skin is very thin. Friction against the skin layers can cause bruising. With aging, the rate of the epidermal cell replacement slows and the skin thins and loses its resiliency. Moisture will leave the skin and increasing the risk for bruising and other types of injury. As the production of lubricating substances from skin glands decreases, the skin can become dry and itchy. For foot health, a key component to patients' mobility, health, and well-being, when thinking of aging and continued exposure to trauma of walking and weight bearing, a patient is more likely to develop a chronic foot problem compounded as a result of poor foot care, improper fit of footwear, and other abnormalities and systemic disease. Older adults often do not have the strength, flexibility, visual acuity, or manual dexterity to care for their feet and nails. At approximately 6 to 8 months of age, infants will begin teething. The first permanent or secondary teeth erupt about 6 years of age. As the person ages, numerous factors result in poor oral care, including age-related changes of the mouth, changes resulting from chronic disease, maybe diabetes, physical disabilities involving hand grasp or strength affecting the ability to perform oral care, lack of attention to oral care, and prescribed medications that have oral side effects. As we age, gums lose their vascularity and tissue elasticity, which may cause dentures to fit poorly. For hair, throughout the life, changes in the growth, distribution, and condition of the hair influence the hair hygiene. With aging, as the scalp becomes thinner and drier, shampooing is usually performed less frequently. The hygiene of sensory structures must be protected in a way to prevent injury to sensitive tissues, thinking about the cornea of the eye and the internal ear canal. Critical thinking like a nurse. We bring in our nursing knowledge, we use best practices, we think about our patient's developmental level as well as their culture, and we make sure that we are non-judgmental. We use professional standards. When considering this slide, note that the assessment of the patient is in the center. The knowledge that we have, the experience that we have, the standards that we apply, as well as our own attitudes are on the outliers, because each of these will affect the patient, the assessment process, and their overall care. You are caring for a non-English speaking male patient. When preparing to assist him with personal hygiene, you should. The answer is B. When caring for patients from different cultures, learn as much as possible from them or their family about their own personal practices of hygiene. While reading this case study, what ethical standards should be applied to allow Mrs. Winkler to make her own decisions related to her care? Assessment of a patient's hygiene status and their self-care abilities requires the nurse to complete a nursing history and perform a physical assessment. The nurse will assess the patient's physical ability to perform or assistance needed with hygiene care that is safe and efficient. This includes the assessment of the patient's muscle strength, flexibility, balance, visual acuity, and the ability to detect thermal and tactile stimuli. As a nurse, we want to determine our patient's mental status, which includes the orientation as well as their cognitive functioning. So, is your patient awake and alert and oriented to person, place, time, and situation? You want to perform an assessment of the skin. You note the color, the texture, the thickness, the skin turgor, is the temperature, and the hydration status. In a healthy individual, the skin should be smooth, warm, and supple with non-tenting skin turgor. We pay special attention to the presence and condition of any lesions, and we want to note any dryness that would be indicated by flaking, redness, scaling, or cracking. When performing an assessment, we want to make sure that we thoroughly assess each of the areas that are listed. If a patient uses hearing aids, we want to make sure that we know that. We're going to make sure that we're looking at their hygiene practices, asking them questions related to their culture and their preference. And then we need to pay attention to figure out what patients might be at risk for hygiene problems. While you're reading this, consider what are some of the assessment questions that the student nurse Jamie could ask Mrs. Winkler, as well as other assessment tasks that could be performed. Data interpretation of the nurse's patient's hygiene status and self-care abilities involves recognizing assessment patterns or clusters of data that clearly identify and label the patient's health problems related to their hygiene. An accurate selection of nursing diagnosis does require critical thinking to identify actual or potential problems. A nurse needs to be thorough in their assessment to reveal any and all appropriate assessment findings or risk factors so they can make an accurate nursing diagnosis. The student nurse Jamie detects halitosis, and she observes that Mrs. Winkler is unable to raise her arms above her head and is unable to grasp the small-handled toothbrush and the hairbrush. What nursing diagnoses do you think would be appropriate for Mrs. Winkler? During the planning phase, the nurse will synthesize information from multiple areas. The critical thinking of the nurse ensures that a patient's plan of care integrates all that is known about the individual patient and key critical thinking elements. The nurse will rely on knowledge, experience, and established standards of care when developing the care plan. Remember, critical thinking attitudes such as creativity when developing a patient-centered plan for hygiene care. The nurse should partner with the patient to identify the patient goals and outcomes, set priorities for the care, and select evidence-based interventions. The nurse wants to consider continuity of care and involve all health care team members. When considering the planning phase of the nursing process, you can understand by this slide that the nurse's knowledge, the nurse's experience, the profession's standards, as well as the nursing attitudes all affect the planning process for the patient's care plan. When reading the goals listed, what outcomes do you think should accompany these goals for Mrs. Winkler? Hygiene is an essential part of basic patient care. When the nurse uses caring practices to perform hygiene, the nurse reduces the patient's anxiety and promotes comfort as well as relaxation. The nurse should consider the stress that hygiene care can cause and be alert for any cues of embarrassment or anxiety. In primary health care institutions, the nurse educates and counsels patients and their family on why proper hygiene techniques are necessary. In the acute care setting, more frequent diagnostic and treatment plans and the need for extensive hygiene care result from acute illness or injury that affect scheduling. In extended care facilities and nursing homes, bathing may be scheduled less frequently. The nurse needs to individualize the care on the basis of the patient's hygiene preferences and practices. The extent, the type, timing, or frequency of bathing, as well as any methods used, will depend on the patient's physical abilities, health problems, and the degree of hygiene necessary. If the patient is physically dependent or cognitively impaired, increase the frequency of skin assessment and provide skin care directed toward reducing the risk for skin breakdown. A complete bed bath, tub bath, or shower can often exhaust a patient. Turning during a complete bed bath and receiving back care will increase oxygen consumption as well as oxygen demand. Getting out of a low tub requires considerable exertion. The nurse should assess and be alert for the patient's activity intolerance during hygiene care. The nurse should assess the heart rate before, during, and after the bath to provide a measure of the patient's physical tolerance. As nurses, we teach our patients to follow a few general rules for skin health. We encourage them to routinely inspect their skin for changes in color or texture and report abnormalities to their healthcare provider. We instruct them to handle the skin gently, avoiding excess rubbing. And we know that patients with excessively dry skin are predisposed to skin impairment and skin issues. A back rub or a back massage usually follows the patient's bath. This will help promote relaxation, relieve muscular tension, and decrease the perception of pain. Effleurage, which is long, slow, gliding strokes of the massage, is associated with reducing the anxiety, heart rate, and respiratory rate. Studies have proven that slow stroke back massage of 3 minutes and hand massages of 10 minutes significantly improve the physiological as well as the psychological indicators of relaxation in our older generation. Routine nail and foot care will often involve soaking the hands and feet to soften the cuticles and the layers of the horny cells, thorough cleaning and drying, and proper nail trimming. The one exception to this is patients that have diabetes mellitus or peripheral vascular disease, or patients who are at risk for tissue ulceration or infection because soaking can cause skin softening or maceration of the tissue. Regular oral hygiene, which includes brushing, flossing, and rinsing, will help prevent and control plaque-associated oral diseases. Brushing will cleanse the teeth of food particles, plaque, and bacteria. It will also massage the gums and relieves discomfort feeling resulting from unpleasant odors and tastes. Daily flossing will help remove food particles, plaque, and tartar that can collect between the teeth and at the gum line. Rinsing helps remove any dislodged food particles and excess toothpaste. Complete oral hygiene does enhance an individual's well-being, their comfort, and stimulates their appetite. We as nurses should base the frequency of care on the condition of the oral cavity, the risk for aspiration of saliva, and the patient's level of comfort. Some patients, for example, a stroke or trauma to the oral cavity or a patient with an endotracheal tube, They can require oral care as often as every 1 to 2 hours. A person's appearance and feeling of well-being often depends on the way they look and the way they feel. This includes their hair. Illness and or disability will often prevent someone from maintaining their daily hair care. When patients are immobilized, their hair can become tangled. Sometimes a dressing or diagnostic procedure can leave a sticky residue on their hair. So basic hair and scalp care will include brushing, combing, and shampooing. When you think about hair care for a woman that has long hair, braiding her hair for her will keep it from becoming all tangled. A young girl with long hair is experiencing a problem with matting. The most appropriate action to take would be what? The answer is B. Rationale is braids will help to avoid repeated tangles. However, patients need to unbraid their hair periodically and comb it to ensure good hygiene practices. When looking at the pictures, letter A is completely in the canal, which is a type of hearing aid. Letter B is in the ear. Letter C would be considered behind the ear. And D is considered a digital hearing aid. As nurses, we want to make sure that we provide appropriate attention to cleaning our patient's eyes, ears, and nose during a routine bath, and when there is any drainage or any discharge. This aspect of hygiene makes the patient feel more comfortable, and it will improve their sensory perception. When we clean a patient's eyes, we need to have a clean washcloth, and we need to go from the inner of the eye, which is the inner canthus, to the outer side of the eye, which is the outer canthus. A patient that is unconscious will probably require more frequent eye care. They will still get crustaceans around their eyes. Routine ear care will involve cleaning the ear with a washcloth and warm water. We want to cleanse the outer ear canal with the end of a moistened washcloth, gently rotated within the canal. Gentle downward retraction at the entrance of the canal usually causes visible cerumen or earwax to loosen and then slip out. If we ever need to irrigate an ear, we're going to have the patient sit or lie on the side with the affected ear side up. For patients and children over the ages of 3, if you're instilling any eardrops or irrigating, you want to gently pull the pinna up and back. This will straighten the ear canal. If you are doing it with children that is younger than 3 years of age, you need to pull the pinna of the ear down and back to straighten the ear canal. This is a basic nursing skill that a nurse needs to know. When thinking about the patient's room, we want to make it as comfortable for them as possible. We need to make sure that their environment is safe and large enough that the patient and the visitors can move about freely. We shouldn't have any barriers around the bed or along the walkway that might reduce or increase the risk of falls. We want to make sure that we have the room temperature, the ventilation, and noise, as well as odors controlled. And we want to keep the room neat and orderly because this will make the patient have a greater sense of well-being. So when you read this case study slide, what maybe are some other interventions that might apply here? Both during and after the patient hygiene, we should determine from the patient whether their care is being provided in their acceptable manner. To evaluate the patient's satisfaction with care, One might ask questions like, do you think your bath helped you feel more comfortable? Tell me ways that I can make you feel less tired during your bath. To evaluate the patient or the family's ability to perform self-care measures, apply the teach back method. Have them repeat to you the information that you have just stated to them. That is considered the teach back method. Once we establish outcomes for the care plan, and if they're not met, we're going to revise it. We want to obviously continue thinking about critical attitudes when we consider all of the evaluation findings. In the evaluation stage, if the outcomes are not met, we're going to think about questions that we're going to involve the patient to determine maybe changes in interventions that could assist the patient to meet those outcomes that were set. After you read this, ask yourself, what other questions should this young nurse have asked of Mrs. Winkler? As a nurse, we know our number one thing that we watch for is our patient's safety. So anytime we do anything with any patients, we're always going to identify them by two different ways. We will ask the patient to state their name and their birth date, and we can compare that with their ID band that they might be wearing. When we are doing anything for our patient, whether it is a wound cleaning or a dressing change or wiping the perineal area, you're always going to move from the cleanest area to the least clean area. We know as standard precautions, we want to make sure that we're always wearing gloves. We should, as nurses, always think about the temperature of any water or any solutions. So if the solution might be room temperature, you might say to your patient, this is going to feel cold. If you consider the thermostat, roughly 70 degrees, and then against a patient body temperature of 98.6, you should be able to critically think and determine, yes, that's going to feel cold to the patient. We want to make sure as nurses that we are using appropriate body mechanics, especially when we're moving patients or assisting patients to ambulate. The number one injury among nurses is back injuries because they don't use proper body mechanics. And when we are delegating, we want to make sure that that unlicensed personnel has appropriate directions so they know exactly what they are to do. Okay, and you can also say to your unlicensed personnel, please repeat the directions I just gave you. That way you can be sure that they heard you appropriately.